Hello and welcome to the second session of today's McKnight's Workforce Development Forum. You've tuned into The Holidays Are Coming. Is your workforce plan in place? We'll be discussing the inevitable year-end staffing crunch and the budget implications that carries. I'm McKnight's Senior Editor, Kim Marcellus, and I'll be moderating today's event. I'll introduce our speakers in just a moment, but first, we do have some housekeeping to take care of. If you have any audio problems during today's presentation, please first check the volume control on your device. This is the most common cause of those problems. You can also use the help button if your own troubleshooting efforts don't work. We will have time for a Q&A session near the end of today's presentation. If you have any questions, please feel free to submit those starting right now in the box on the left side of your screen. And while we don't have any slides today, I'll remind you at the end of our conversation how you can rewatch this session or share it with others after the live event is over. Now, regarding continuing education. This educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards. It has been approved for 1 clock hour. However, you do need to stay tuned for the entire event during its original broadcast to receive a certificate. You can track CE requirements through the course completion tracker, which is accessed through the last icon in the area below the open webinar panel. Once you've achieved 50 viewing minutes, a View Certificate button will display, and the required viewing duration will have a green checkbox. You can then view and save your certificate. A copy also will be emailed to you after this session. And now, for the reason you're here, let's meet our presenters. Sean Carney is Vice President of Client Services for IntelyCare. Sean joined IntelyCare last December, and he previously was president and owner of 2 skilled nursing facilities. Prior to that, he was president of CMC Healthcare Management, which operates multiple centers, and he was with Brookdale Senior Living. He's been a certified skilled nursing administrator since 2004. Jennifer Rictor is president and CEO of Rictor Healthcare Consulting. Her namesake firm is a nationally recognized leader in financial and consulting services for organizations across the long-term post-acute care spectrum. Rictor provides clients of all sizes and scopes throughout the country with customized and leading-edge clinical financial accounting, implementation, and revenue cycle solutions. And Landa Strickland is Director of Clinical Consulting at Rictor. Landa leads the clinical team as they provide clinical, operational, and EHR solutions to post-acute healthcare providers. By keeping apprised of federal regulations and changes across the LTPAC sector, she prepares clients to proactively meet new expectations through Rictor's custom design services. Welcome, everyone. And with that, we will jump into today's conversation. So we kind of came up with this topic looking at the calendar, obviously about 6 weeks left in the year. And we know facilities are gearing up for the busy holiday season and putting together their 2024 budgets at the same time. So as we head into this high demand period, Jennifer, how are you finding facilities are positioned with regard to their 2023 staffing spend versus what they budgeted for? Jennifer, you might be muted. You're good now. Go ahead.
Sorry about that, Kim. Thank you. So many providers are still struggling with labor shortages and a super competitive recruiting environment, resulting in increased operating costs this year and therefore smaller operating margins. So I think the first step for providers at this point going into the end of the year and hopefully looking ahead to 2024 is taking a good hard look at where they're at this year. What is their reality? What financial and statistical data is provided to the leadership team of the organization so that they can assess the position accurately and timely to enable them to make educated decisions about what action steps need to be taken to prepare for year end and prepare for going into a new year. Occupancy rates are climbing across the country, but the labor market is still tight. So finding staff to support the increases in occupancy and maybe a more acute case mix has been a challenge. Providers should take a look at where they were this time last year, identify trends perhaps complete a SWOT analysis, strengths, weaknesses, opportunities, threats, that will assist them in strategic planning for year end, but also, again, looking forward to planning for 2024. Are you moving the needle? What has worked this year? What has not? Planning is super important. I can't stress enough the importance of taking the time out of our busy schedules to develop those strategic plans. So staffing, we know, is a gap. Quality benchmarks. Are we meeting those quality benchmarks? Do we need to create or recreate strategies to address that area, over the next 12 months? Where is your staff spend relative to your 2023 budgets? Census and patient days may be up, but labor costs are probably incrementally increased to a greater level because of more reliance on expensive forms of staffing, such as contingent staffing. Are we using the technology? Are we using data from our workforce management solutions to measure our staffing levels to state-defined minimums? And also comparing that to our occupancy and case mix or acuity levels in the building. So again, it all starts with data. So do we have the technology in place to provide the data for us to make meaningful decisions? Assess what percentage of our staff is represented by contingent staff. And have you developed partnerships with those staffing partners to fill the gaps in your organization? Have you created a collaborative strategy with those partners?
That's something we've talked about quite a bit this year, and the idea of most of us, not me, most of you are using agency. And if you're doing that, let's do it in a smart way. Let's have a strategy and go about that. Sean, I think you can bring some more perspective on that today, particularly, again, reminding folks you're a former owner and operator. What do you typically see at year's end, and what do you think's happening out there this year? Sean, I think you're muted too.
Sorry about that.
There you go. That's okay.
I think that I'd like to echo what Jennifer said in her opening remarks, and that is to take a really good hard look at the position, the facility, the group of facilities, or whatever care center you're looking at. See really where you are. Each year is different. The culture of the facilities and the outlook of the facility is extremely important when identifying what the needs are going to be as the holiday season comes up. I think that things that you want to take a look at are survey results, turnover rate within your internal staff, your current census, and what your projected census will be. These are items that, to Jennifer's point, with the proper data in place, you should be able to identify where these holes may come up, and understanding what the feeling is within the facility and the stress level, so you do not end up overtaxing both your human capital resources and your financial resources to a point where you cannot end the year strong and be willing and ready to enter the following year in a good position to succeed.
So Jennifer, can you walk us a little bit through more deeply on what Sean touched on? What are the staffing needs typically at year's end when you have a lot of people wanting some holiday time? Maybe they haven't had a chance to use their vacation yet this year. Walk us through that, please.
So I think, I can't stress enough the importance of technology. Do we have the right technology? Are we using it properly? Do your different solutions talk to each other? Are they integrated? The worst thing to me is investing money in strong technology, and you've got different solutions across the spectrum of your organization or operation, but they don't communicate with each other. So, do you have an electronic workforce management solution, and does it work with your EHR package and your payroll package? So we need to be able to access data at the drop of a hat. We need almost real-time data to make these decisions. So that's, number one. Looking ahead over the next 6 weeks of the year, what is the anticipated census, case mix, and your acuity levels through the end of the year? What is your patient population? What are their needs going to be? And again, drawing on history is probably the best way to determine that. Communicating with your referral sources, your discharge planners in the hospitals. What are they seeing or anticipating over the next 6 weeks in terms of viruses? We have all of these viruses going around. Are they surging? Are they anticipating that we're going to have a surge? Elective surgeries. So I think that working with our referral partners, that can help us glean a projection of what to expect this year. Occupancy generally during the holidays, I think, is a little bit lower. But again, there's all of these other, influencers out there that will impact that. Is your community or facility going through any programmatic changes? Are there any new care initiatives underway? Are you possibly looking at migrating your EMR package on January 1st? Well, the work for that starts now at the end of the year. So is that going to require additional resources? So all of these things will help to drive those staffing benchmarks. Vacation schedules. So again, using your workforce management solution, we want to be able to forecast that's the staffing benchmark and what the staffing needs will be. We need to also consider vacation schedules. Communicating with your staff now. What are their vacation and holiday needs? What are your policies on vacation time? How, you can't have everybody taking time off at this time. So what are your policies? If you don't have effective policies, maybe now is the time to think about creating them for 2024. So that'll play into next year. Are you in the survey window? Typically we don't see that during the holiday season, but it's something else to consider. You also want to protect your MDS nurse. You want to protect those the leadership nurses in a leadership capacity, and you want to protect that MDS nurse. The last thing we want is to be pulling that very important resource from their job and their focus. What is admission activity? Again, engaging your admission staff. So it's really an interdisciplinary effort, bringing all the stakeholders together for this planning process. And I think, staffing is a fluid process. It's daily. Staffing, scheduling rather, doesn't stop. So what are your scheduling protocols and strategies? I mean, that should be real time. So the other aspect is to look at cash flow. So I know we all look at our income statements. Are we making money? Are we losing money? But, those income statements need to translate into cash flow. So do we have opportunities with our revenue cycle team to boost cash flow for the end of the year to cover the additional costs that we may be experiencing with more expensive staffing?
I had two quick follow-ups there. I read recently that there is a trend at the end of year for elective surgery because many people want to either get some kind of insurance benefit or use up their, they've paid their deductible, they want to get the benefit. Does LTC typically see those patients, or those are the knees, hips, joints that now go straight to home care?
I think that I think there's a combination. I think a lot of those do end up moving through the continuum of care. It takes a strong support network at home to be able to care for somebody right out of an acute setting after those elective surgeries. So, a lot of times if you don't have that support network at home, then they've got to go into that type of care setting. Landa, do you want to expand on that at all?
We do see a lot of the electives go home, but there are still those that clinically can't go home. They have several comorbidities that need to be treated, as well as the fracture and the wound site. So I would say it's about 50-50 of those electives that go home, and other are in the facilities.
Okay, good. So that is something else. I think, Jennifer, your suggestion about talking to your referral partners, they probably have those surgeries on the books, so get a sense of whether any of those folks would be coming. That's helpful. I just didn't want to overlook that for our listeners who are maybe more on the post-acute side. So Landa, I'm going to come back to you and turn a little bit and talk a little bit more about, how to set goals and how to meet them. So, you have determined what your staffing needs might be for the next 6 weeks, but certainly things change, always fluid, like Jennifer said. What strategies do you recommend to really stick to your plans?
Well, when we're considering staffing, whether it's holiday time or throughout the year, clinicians understand that even the best laid plans can fall apart, but not anticipating interruptions in staffing patterns can really be disastrous, particularly during the holiday. So we want to have a good strategy. I recently was reading a leadership book, and a point came out that I thought was very interesting, that strategizing is like making a bet. And I had to think about that for a minute. But it went on to explain that the skill of anticipating improves the odds of success. So in our case, a strategic approach to holiday staffing, it's critical. At this point, though, some holiday staffing may have already been arranged or occurred,
Sure.
but over the next few weeks and well into 2024, I think it's important for nurse leaders to really find out what's important to their nurses. I came up through the ranks. I was a nurse aide, so that was before certification, and I'm telling my age basically. But I was also an LPN floor nurse, an RN, a DON, and I administered a building. So I'm confident for the leaders in our facilities, you're not going to please everyone, but it's very helpful to have a plan. First and foremost, be empathetic to your nurses, particularly your new hires. They may not have accrued enough days to take off during the holidays, but it's nice if the leader kind of acknowledges that they understand that they're in a new role, and be empathetic with that. Also, find out if some of those new hires that we want to retain, some may want Christmas Eve off, some may want Christmas Day, and make sure it's a formal process, but maybe we can accommodate that. One of the things I identified as an administrator, I had a very, very culturally diverse facility. And I found that all of our American traditions aren't everyone's traditions. So often there were we could trade off traditions where some of our staff, our nursing staff, would work our American traditional holidays and take off on their traditional holidays. And it worked out very well. Also, please be sure to recognize your staff when they work these holidays. Let them know that they are appreciated and recognized. And appreciation doesn't have to be costly. It can be just a small note. People appreciate just those small bits of recognition. And lastly, think about your visitors. Do you have a lot of visitors during the holidays? And do you need maybe some leadership in the holidays? Does leadership take off all the holidays, or are they present in the building for a period of time? The last thing, Kim, I think I want to mention is that sometimes during the year, we often think about what our facility looks like. We want it to look aesthetically nice. We want it to perform well. We want to know how it looks like in its performance. But what do you want your nursing department to be? So does it function as a unit? Is it organized? Are they collaborative? Are they empathetic to each other? And are they kind to guest nurses or those contingency nurses? What kind of environment are we using to welcome that extra assistance that we need into the facility? And lastly, I think it's very important from making sure those staffing gaps don't occur is for your nurses to feel very supported and very appreciated.
Yeah, I was going to say this when Jennifer was speaking as well. I think the idea of treating your staff right and building culture is important all year. But at this time of year, people are starting to think about resolutions. They're spending time with family and they are thinking about, what do I want? Am I meeting my personal goals? And so I think as an employer, it's really a good thing for you if you leave people with good impressions at the end of the year and make them want to come back for 2024. One thing you didn't touch on, Landa, I wanted to ask you about was how do you determine, and maybe there can be different opinions, I'll ask Sean this question too, who gets off? If for you, was it tenure? Was it first requester? What do you suggest there and what have you found to work well?
It usually comes with an already established policy in most cases. And typically it is first come, first serve in many facilities. Sometimes it's tenure, but that tenure isn't always the best because the same people tend to get off almost all holidays. So
Right.
you really have to understand the policy and procedure first, and then also understand how your staff perceives that policy. Do they perceive that as being fair? Do they perceive that as being equal? And so I think probably in skilled nursing facilities particularly, it's varied based on the policy that the facility has for time off.
Okay, and Sean, I'll pivot to you. Let's get your opinion on that first, tenured versus request order or some other policy. What do you suggest?
I always tried to, when I was operating facilities, I always tried to do a blend, much like Landa stated. First and foremost, it would be based off of the current policy of the facility, but you do have to take in a few other factors, such as, maybe it's amount of shifts or hours worked over the course of the year, or more importantly, in the fourth quarter, workload. I always added a performance factor to it. I mean, the people that are working hard and are stepping up in times of need, I did always like to reward them as best as possible. But in reality, it comes down to one of the other points that Landa brought up that I thought was tremendous, is really taking a look at the nursing department and all departments, both individually and in the collective, and understanding how they operate together, understanding their teamwork ability, their ability to communicate. And oftentimes, especially in the more mature facilities or the facilities with a deep-rooted culture that have been successful for a long period of time, I found that the staff themselves were able to sort it out if you gave them the proper tools and time and forum to have these discussions, not in the middle of the hallway, not in front of other residents or the family members or visitors, but actually giving them the proper forum to make these discussions. It really came down to less than a handful of particular shifts or individuals that you had to work with to handle those requests.
And maybe we can get to this later on in the conversation, but I know technology can play a role there too in terms of self-scheduling and some of the apps that are available for that. But let's pivot a little bit and talk more from your perspective of a workforce provider. Certainly you can plan and you can have goals that are lofty and you work really hard, but you're still going to have no shows, or you're going to have people who give you 1 day notice. Talk a little bit about, the benefits of providers really identifying what their needs will be and maybe anticipating them, strategizing, and how that could help them this time of year.
Sure. Again, going to pivot off of what Landa said earlier, but with respect to how early you can start to plan and anticipate those needs, you put the facility or the community in the best place possible for success. And there's a few reasons why. Number one, you can create a viable financial plan, and that is in both the revenue side and in the cash flow side. These providers of contingent labor will be sending bills at a very difficult time of the year for these facilities. So understanding where your cash flow really sits so that you do not fall behind on any invoices, really understanding what your contract language is so that you're prepared to handle those invoices. Another thing is, to Jennifer's earlier point, is what is your relationship with your current vendors? Do you have corporate agreements? Do you have a true partnership agreement in place? And if so, is there some flexibility around this end of year crunch or the holiday season to allow for maybe some longer pay terms or some flexibility in the pay terms? Are you anticipating any holds by the state with respect to reimbursement? These are all factors that you want to take into consideration early on in the process so that you're fully prepared for that time and that your account doesn't go on hold unexpectedly and you're unable to fill those shifts. The other thing is, if you're working with a provider on a regular basis, you may have relationships built up with, we call them IPs, but care professionals that are in and out of the communities on a regular basis. These are the folks that you've identified that you enjoy working with. You want to make sure that they're available because, quite frankly, if you're enjoying working with them, probably the other facilities are as well. And they may want to plan for them to be in their facilities. So to Landa's earlier point, if you're really trying to put your best foot forward while there are additional stakeholders, whether they're family, friends, visitors, are in the facilities, you may want to make sure that you have the cream of the crop, so to speak, professionals there in the building. That's one way to assure or start leading towards success around the holiday season. And then thirdly, one of the thoughts that comes up is being able to provide messaging to both, or to all the parties, all the stakeholders involved, the residents, the family members, the visitors, the internal and external staff. Pre-planning that communication allows for everyone to show up, be prepared to enjoy and perform, whether it's the visitor who comes in and is expecting to see the longtime CNA that's been caring for their mother and father for years and years. They may be away for this holiday season. You may be seeing an agency staff member caring for their mother and father, and that may lead to questions. Preparing them for that will alleviate those questions and will help to make that experience more beneficial for both the visitor and the loved one that's living in the facility. Same would be said for the labor, both the internal and external labor. Having the other departments within the facility, not just nursing, understanding who's going to be in the building, who can they turn to if it's a decision that needs to be made, making sure that your communication lists are up to date. And you may even want to, we've explored this on other webinars, we may even want to have a one-page orientation put together if you're going to have any new staff members, both internal and external, in there around the holiday season so that they feel confident that they can answer any question that's asked, especially in front of a family member that may not be a regular visitor. These are things that come up in facilities all the time, and to whatever extent you can be pre-prepared to handle those interactions makes the facility look like it knows what it's doing, and it's been doing that all year long. And that's what you want the perception to be in the community.
Yeah, it probably makes that caregiver feel better equipped and more confident as well. That's
Absolutely
great. and I just wanted to ask one quick question in terms of placing staff on actual holidays, because again, I think you've got to back up and anticipate, okay, I'm going to give many of my nurses off. You should be reaching out now, correct? To try and find out if your partner has staff available to fill in on those key days.
Oh, absolutely. We, especially here, we have multiple account managers that are already working on the Christmas and New Year's schedule. They've been working on it for the last 2 or 3 weeks, anticipating that need, because to the point that there are vacation requests that you want to fill. We also have, as a W-2 employer, we also have vacation requests that we are trying to fulfill. So we have our managers that work with the IPs directly, trying to understand what their availability and schedule looks like, and the facilities through the account managers. So it's a two-sided operation. And, again, communication is key. The earlier that you can start that communication, the better off both sides are going to be.
I think otherwise you get into that situation that I forget whether it was Landa or Jennifer mentioned it, the MDS nurse, the DON, all those folks are going to be filling those CNA shifts if you can't find anyone else. So, all right, sorry, Jennifer.
Kim, I just want if you have a long-standing relationship with your, staffing partner, you probably are familiar with some of the staff. So you may already have experience with known good performers. So you want to ensure that, you're able to request and have those folks joining your team through the crazy holiday time.
So
right,
let's
Sean?
stay together here. Yeah, I mean, I think the message we want to get across is, yes, there's 6 weeks left, but those 6 weeks are going to fly by. So let's work on this now for sure. And Jennifer, I want to come back to you and talk a little bit more about the financial calculations and implications. So again, we're progressing here now. We've identified the clinical needs. Now we have to identify who we're going to hire and how we're going to pay for it. So talk a little bit about identifying the gaps and what steps you take from there.
Well, I think the first step is, we need to break down the silos in our organization. So, the finance and the accounting folks are critical to the process in being able to assist our operations folks with planning, identifying where those gaps are, and planning not only operationally, but financially. So the teams have to work together. And we'll talk about this also when we look ahead in planning for 2024. But all of these teams really do need to come together, and it's all about culture in your organization as well. Do you have a culture of silos where people are focusing on their own agendas, or are they working together with, to overcome shared challenges? So your finance folks are important components to the overall operation of the organization. So working with nursing and scheduling to understand what the forecast is for staffing with in-house staff, and helping them to identify gaps, and then putting some cost to that for leadership so that they can make financial decisions going into year end. Planning cash flow, working with your revenue cycle team, as I mentioned before, to make sure that the organization has the cash to meet the demands of that plan, of that staffing plan. Are we managing accounts payable? I think Sean touched on that our staffing partners, they have payment terms that, they need to uphold. So out of respect for the relationship, we need to make sure that we're paying our vendors timely. Otherwise, we run the risk of, not being able to call on those partners when we have the greatest need.
And obviously that means your business office has to be doing its job and billing and making sure they're tracking all of those metrics on the receivables side, which is a whole nother topic. But it's, like you said, it's not siloed. Everything is one string connected and you pull it tight. And this is the time of year that happens. So what are some appropriate steps for planning and budgeting for next year based on what we're finding out at the end of this year? Jennifer,
so
I think
go ahead, Kim.
I was just throwing it to you.
Sure. Yeah, absolutely. So, I think it's important for us all to stay in tune with the industry. What are the trends? What are the regulators doing? What can we expect from, a regulatory environment next year? We've got these broad staffing requirements that may potentially affect us next year. So we really need to stay in touch with what's going on, counting on the thought leaders in the industry, counting on our associations and, media that is keeping us informed. I think, again, staying in tune and keeping abreast is very important. It's a very dynamic, quickly evolving industry. So that is going to set the tone for our strategic planning. I'm going to go back and reinforce the whole concept of planning. And it needs to be interdisciplinary. So planning doesn't just fall to the finance department. Many times I ask an operator, how are you preparing your budget? What is your budgeting process? And they say, our accountants prepare those budgets. And I'm sure a lot of our staff out there listening can appreciate that somewhere in an office, numbers are being crunched and there's some plan that's being developed. Well, I think that all stakeholders really need to be involved in that process. So our operating teams, our clinical teams, admission, administrators, everybody's got to play a role in this. And, from the strategic plan that takes into consideration a lot of the historical information. When we talk about doing a SWOT analysis and looking back at the last year, that's going to drive our strategic plan for 2024 as well. So taking that into consideration, we want to flesh out the plan and the tactics and create goals. So everybody should have goals in the organization that support that overall strategic plan. Hand in hand with goals comes the numerical narrative. So an operating budget is the numerical narrative that supports that strategic plan and the goals of every department in the organization. So in developing, oh yes, Kim, go ahead.
I was just going to ask, do you see this as a good time of year to think about if either I need more staff or I need more revenue, creating new partnerships in terms of ACOs, iSNPs, some of those creative payment models?
Yes, absolutely. I was going to say that. So that is, we need to understand the market. We need to build those payer networks that are going to support our revenue goals. So staffing is on the expense side, the cost of doing business, but is our revenue where we want it to be, our occupancy and our payer mix, our acuity levels? So do we have opportunities to work more closely with our community hospitals, participating in ACOs, exploring iSNPs and doing some analysis on that with your particular patient population? Is that something that would be beneficial for your organization? That's all going to be part of that strategic planning. That's a good point, Kim.
Okay, great. Let's go back to talking a little bit about workforce partnerships. So, Sean, I think we'll come back to you here. So obviously, partnership really important for these 6 weeks, but beyond the crunch times, how can a partner contribute to the budget process Jennifer has laid out? And how can you guys together create an optimized operating budget?
Well, I think playing off of what Jennifer said, understanding what your facilities opportunities are leading into 2024 and understanding what the needs are first and having that spelled out in a partnership through the contract in language that is beneficial and able to support both the facility and the contingent labor partner. That's first and foremost. And again, end of the year, leading into the new year is always a good time to explore these explore this contract language and make sure that it's on par with what the needs are of the facility. That's number one. Number two is understanding what the opportunity is with your referral sources. You'd want to be able to have, again, going back to the messaging, having the proper messaging in place so that we kind of move away from the stigma of agency, and helping the referral sources understand that your partner that you are working with, you have open lines of communication, you fully understand that their care professionals are credentialed, trained, familiar with the facility and the residents, are local staff versus travel, are they W-2 staff versus 1099. These are items that you can use, the facility can use to their benefit when approaching these referral sources, especially new referral sources. If you're looking at opening, let's say, a new wing or a new line of business, understanding what those parameters are and what the ability is of that contingent labor force, both as individuals and in their ability to meet and hopefully exceed any kind of staffing limit that may be new to a state or one that has been increased in your current state. These are all factors that the referral sources are going to look at when they start to tier out their partners, where they're going to send their patients or residents when they get to the facility. So you want to start to build that relationship with that referral source early. That's something that you can work on with your partner in this space, especially in the realm of data, right? So many of these contingent labor workforce management companies have access to a tremendous amount of data. I know that we do here at IntelyCare, and we are happy to provide that to both the facility or the referral source. So it's another way to leverage resources to make the facility shine. Another one is that I had written down while she was speaking is understanding what the facility needs and understanding where the gaps are. Have you met your 2023 budget and that financial narrative? And are you realistically able to meet the 2024 budget and financial narrative? And if the answer is no, and the ability to increase the census is one of the ways you're looking at it, you really have to be realistic with what the staffing needs are going to be to increase that census number. And you want to make sure that you're fully prepared both internally and externally with respect to staffing, so that you do not fall short in quarter one and quarter two, and then you're in an uphill battle for the remainder of the year. Those are really my thoughts on that.
And I think, Sean, you really bring up a good point. Once you have created your budget and you forecasted your revenue for 2024, you have to be able to support that revenue with staff. So really projecting that out, the type of staff, what skill level do you need to meet the acuity mix in your facility for your skilled patients or your long-term residents. So that those two areas of your organization or your facility are going to require much different types of staff. So, and two, I think, once the operating budget is set, it's established for the next year, we need to revisit it. Don't let it sit there and collect dust. So that needs to become part of the daily. I don't mean daily literally, but that needs to become part of the workflow, the process in the organization to review the financial data timely. We should be seeing financial data by the 10th of the month for the prior month. So we have time to impact some change in the current month if we see things have gotten off the rails. We need to also project out in simultaneous with the operating budget, we need to be able to tie in cash flow. So, taking the information from our budgets And then understanding the payer sources. So we had talked about creating payer networks. So we need to understand the payment habits of those payers. So we want to work with payers who are going to pay us promptly, right? So, maybe some of those payers don't belong in our network anymore. Taking into consideration those payers' habits then is going to help us have an effective cash forecast. We need to also look at things that may create snags in cash flow or the revenue cycle process. We need to protect, I mentioned before, we need to protect that MDS process because that's driving our reimbursement and our cash flow. So making sure we mitigate any risk in the area of MDS, making sure that we always have a bench to call on if we have somebody that's out for a long-term period or we have turnover, making sure there's somebody that's cross-trained to step in and fulfill that role. Breakdowns in the front-end process. Everything begins with the pre-admission and admission process. So really taking time now to assess that. Staff turnover. Again, we need to have succession planning and contingency planning for the leadership and administrative staff that support the whole process of providing care and bringing sufficient staff into our buildings.
And I think
if you don't mind, I'll jump just to respond quickly to one of the points Jennifer made. This is also an excellent time of the year to assess your educational capacity for the facility, understanding what goes into the reimbursement model for your particular state, and understanding how we get to the overall number that we get per day for each resident, and then making sure that the staff understands what needs to be captured through that MDS process, what needs to be charted on, what are we trying to capture, making sure that the residents, making sure the staff members know that capturing their work through the EMR is extremely important in that process. And then any other educational needs. This is a good time of year to say to yourself, have I met my educational goals for 2023? And if no, what do I need to do differently in 2024 to meet those goals? And that should be looked at for both your internal and your external staff, because even the best laid plans can be derailed if we're not capturing all the data on the up front and making sure that we're, accounting for all the actual hard, good work that these staff members are doing on a daily basis with the residents.
I'd like to just follow up on that briefly. Sean, you said it very well, and Jennifer as well, from a clinician's point of view. Really, your revenue starts with that admission and having a team that works collaboratively with the common goal of assuring that we're capturing the acuity of the patient. And that's where that documentation comes in. And it's so important that our nurses are well equipped and are sufficient so that all of that documentation gets in place. So very, very good points from both Jennifer and Sean.
So I wanted to bring up one Q&A of my own before we jump to our audience questions. We talked about rate setting. Sean, you just talked about reimbursement at the state and national level. I think another thing that I write about often is wage setting, because we see this huge survey from HCS every year, and we've seen those numbers climb depending on level from 8 to 11% in some categories the last 2 years. And one thing is consistent. Every year for their placeholder amount, the survey takers say next year we're going to give 3.5% raises. And as unrealistic as that has been, it continues to be apparently what they're putting in their budgets. Jennifer, maybe you want to talk a little bit about how, for your own employees, we can do a little better and maybe get a better benchmark of what we need to plan for next year.
Yeah, I think it's funny when you mention, everybody's going to get 3.5% increase. I don't think everybody should just get a blanket increase. I believe that increases need to be tied to performance, number one. So we need to make sure we're engaging our HR leaders to develop a tool for us to measure and monitor performance, evaluate their effectiveness in their role. Are they meeting expectations? Are they delivering on those goals that we've established during our strategic plan, right? And I think that even frontline staff can have goals and they can have performance benchmarks. I think that, everybody definitely needs to have some form of cost of living increase, especially, in this era of tremendous inflation, and hopefully that's leveling off now. I can speak for myself. For our firm, Kim, we have had to raise salaries substantially, salaries and benefits through COVID substantially, because the job market had just gone so topsy-turvy that to attract or retain talent, we really had to up the bar on compensation packages. So I think that has started to level off, but now that we've gone through that major investment in our people, maybe 3.5% isn't going to be achievable every year. I don't think people should expect that.
Okay. Did anybody else want to jump in on that? Probably we can pivot then to some of our audience Q&A. We have about 5 to 10 minutes left here. So let's start with this question, Jennifer, for you. With the ever-changing landscape of reimbursement models across the country, how can a provider best plan and budget with a difficult-to-project case mix? That's a great question. It's always fluid. Let's go back to that word.
I wish we all had crystal balls. Wouldn't that be great? Then we would know what we need to do next year, but we don't. So we have to work with known sources, known facts. And, number one, I'll repeat my point about having that relationship with our referral sources and getting a sense of what's going on in their world. How are they predicting and projecting for 2024? Our referring hospitals. What do they predict in terms of the subacute and rehab needs in 2024? Where are the trends in healthcare? Historical data. History repeats itself, right? So, looking back over the past 1 to 3 years, what are some trends that you've seen not only in the industry, but in your organization? So using that data to help you model a fairly close projection for next year in terms of case and acuity levels.
Okay. And Sean, I'll pick on you next. So whether we're talking about these remaining 6 weeks or looking forward maybe to a new partnership in 2024, what factors should a facility consider when choosing their workforce partners?
I think it's important to understand what the partner can provide for them, other than the human capital. Are they able to help provide the education for their staff members? Are they able to provide the data for the reporting that's now required, both the reporting that was always required and especially the new reporting that's come within and post-COVID times, so that we are making sure that your partner is not causing the facility any issues on the front end, but is also able to help them capture any reimbursement that's available, any additional or supplemental funding that's available that can help with the cash flow. You also have to understand really what the supply is for your partner and really diving down into those numbers so that when called upon, can they help provide that staff for you so that you're not wondering whether that shift is going to be filled, wondering whether you're able to take the increased census that's available to you. And that's what you don't want to do. You don't want to leave the facility leadership in a position where they have opportunity, but they're unable to act on that opportunity because they cannot back it with the necessary staff or reporting that's required. So making sure that you have that worked out on the front end and making sure that that partner is able to support those needs is paramount moving into the new year.
All right, so this will be our last question for today. I'm going to start with you, Jennifer. Obviously, you have clients all over the country in multiple states. Can you tell us a little bit about what you predict, crystal ball again, the financial outlook of the industry will be in 2024?
I think it's going to be a lot of the same as we've seen in 2023. I think occupancy levels are going to continue to increase. As our population is aging, I mean, the numbers don't lie. So we can actually, predict the future to an extent by looking at the population and what we know about life expectancy and chronic illness and some of the care, healthcare needs. Those occupancy levels in our facilities are probably going to continue to increase for 20 to 30 years to come. The demand for institutional care will grow. As much as people want to age in place and stay home, I just don't think that that's always possible or achievable. There just isn't enough resources in home, I think, to appropriately care for people who have chronic illness, or even an acute episode that needs, that short-term rehab. The SNF setting is obviously a lot less costly than the hospital setting. So hospitals are going to constantly be trying to, move people through the continuum of care. I think from a consumer standpoint, there's a greater sense of trust in the market. And I think as a result of increased regulation and transparency. So I believe it's going to be survival of the fittest. Quality providers will thrive. We're starting to see slightly higher reimbursement from government payers. But again, government payers are going away. It's all, we're really working with private payers now. Government agencies, they're the policymaker. They're going to get out of the payment. So we're going to be dealing with the commercial sector. So again, we need to be selective and strategic in how we build those payer networks. I think there's going to be increased M&A activity, mergers, acquisitions. There's going to be a lot of change in ownership and operators. There's a lot of, I think, optimism in the market for the direction the industry is going in. Staff shortages, we're going to experience that, I think, to the same level in 2024. It's a very competitive market. So again, we need to be relying on all of the tools available to us and planning ahead to make sure that we can offset some of those gaps in our organization, because that's going to bring us down. So we need to be meeting those quality benchmarks. We need to be meeting our budgets financially so we remain viable and we can reinvest in our facilities. So I think there's also going to continue to be more demands on, regulation, unfortunately. So providers need to find a way to be very efficient with some of the administrative burden we have. So again, using technology, process automation, looking to outside providers and outsource some of those areas and functions that are straight overhead in your organization. There's probably more cost-effective solutions out there than trying to employ a lot of those administrative staff members.
Okay, lots of areas to focus on. I hope people have a lot of time on their calendars for 2024. All right, well, that brings us to time for this session of today's Workforce Forum. I'd like to thank all three of you for being here with me to discuss this. I thought it was a great conversation. Of course, we also want to thank our sponsor, IntelyCare, which you can learn more about at IntelyCare.com. And that's not all we have for you today. You can make time to come back for our final session of the 2023 Workforce Development Series. How Individual Workers Are Revolutionizing the Healthcare Workforce begins at 1:30 p.m. Eastern right here. And also to rewatch this session or share it with others shortly after today's live event, you can see McKnights.com 11/14/2023 Workforce Development Forum. Thanks again to our audience for joining us here and to our speakers. For McKnights, I'm Kim Marcellus. Have a great day.